Hi, everyone. So it's Tamanika Marshall, your favorite family nurse practitioner, and you guys are in for a treat. I have Russ, and she is the nutritionist of DFW. Okay. Like we met at an event at a church, and I heard her speak, and our wavelengths were wavelengthing.
Yes.
Okay. We talked about GLP-1s, which is semaglutide, tirzepatide, nutrition, diabetes, obesity. But you know what? I'm going to allow Russ to tell you about Russ. Okay?
Yes. Well, no, thank you for having me. I'm so excited about this topic, but also to just so blessed that we met in the place that we did. And yes, the wavelengths were a wavelength thing because it was just like automatic in terms of our philosophy and our approach to our clients and our patients. So yes, I'm a Russ Powell, registered dietitian and certified diabetes care and education specialist. I am here in DFW, and yes, I do pride myself on being one of the best when it comes to managing type 2 diabetes, but also to making sure that people understand the medications that they're taking, especially the GLP-1s. And a lot of things are falling through the cracks when it comes to helping people understand how to get the most out of this medication to where they can take their lives back. So I'm excited.
So can you tell them about your start into this? Because I remember hearing about you being in the hospital and why you're out here doing it. I just want them to know.
Yeah. So my journey, my professional journey as a registered dietitian started in clinical.
Yeah.
And in the clinical setting, it is a revolving door. It's not necessarily to help you live a life that is whole and balanced. It's just to get you stable, maybe put a Band-Aid on your condition. And so what was the turning point for me is that I just saw that I wasn't part of the solution when it came to our healthcare. And nutrition is such a huge component of how we age, and also adding health years, increasing our health span.
Yeah.
And I wasn't able to do that. And so whenever I figure like, oh my God, I've invested so much time, money, energy into becoming a registered dietitian, and this is going to be my result, is just handing you a handout, giving you a number that no one picks up on, and you only get 5-10 minutes with me.
Oh, yeah.
And then I'm talking to you when you're in one of the most compromising states. You have so many people coming in, poking and prodding you, asking all these questions, and I wasn't effective at all. So I really pride myself as meeting the person where they are, but empowering people, because everyone has a different lifestyle, different circumstances. And I don't want you to feel like you taking back your health is impossible. We should have a partner. So that's how my journey started, was in clinical in the hospital. And then I transitioned over to corporate, where it did give me a little bit of autonomy to come up with different strategies and solutions. But again, it's corporate. You have to kind of stick within the box. And so, but it definitely gave me insight as to what it would look like to work in private practice. So I've been in private practice now for 5 years. Yeah.
So that's why I wanted to introduce Russ to you guys, because for one, here at Lenore, we're all about empowering you to become an active participant in your healthcare by looking good and feeling great. And it's about analyzing and seeing the things that need to be changed, but having providers on that willingness to be on that change journey with you. Right? So some of the things that we're going to be discussing today may be a little bit different than what some of your other providers may tell you. We always recommend that you follow the recommendations of your provider. Okay? This is not to replace any type of medical knowledge or information that your provider has given you. So that is a disclaimer. We are doing this just to have a friendly conversation, to educate you on some of the things that we are seeing in our personal practices and collectively with some of the hottest medications that are out there currently to get you happy, healthy, and whole. So we're going to dive right in. So we love semaglutide. We love tirzepatide, to use it as a tool.
A tool. Yes.
It is a tool.
Yes.
And nutrition is part of that process, right? I think some of the statistics are showing like 80% of weight loss is through nutrition.
Yes.
And 20% is through physical activity.
100%. Yeah, you definitely can't out-eat a bad diet or work out a bad diet at all. It's impossible. But also too, you're feeding a living organ, right? And so if you're putting not so healthy foods inside your system, you're not really going to get that recovery or that muscle build or even the energy that you need to, push through exercise. And also to just the hormonal disruptions that can happen with the types of foods that we're eating and the timing of our meals and all those things there. So nutrition is pivotal, especially when it comes to the GLP-1 class medication in terms of getting the maximum benefit of it, because I know that you guys have probably been Googling or seeing things. Everyone talks about the horrible side effects. Yes. And then what I've seen is that those who have experienced some of the negative side effects, and often is tied to nutrition. Yes. In terms of how they are pairing this medication with the foods that they eat. And so, and also too, the conversations that are not being had with their provider when taking this medication, leading them to these negative side effects. Yeah. So
let's talk about how you can prepare your body for starting the medication regimen, if that's what you choose to do.
Yes, absolutely. So when it comes to nutrition in terms of priming your body for this medication, the GLP-1 is going to slow down gastric emptying. So what that means is that it slows down the time that it takes from get to the front door to the back door. So it slows it down. And so with that, it's a gut medication. So we want to prime that gut for that medication. So what we want to do is make sure that we are taking this medication, preferably in the morning. I know most people do that at night, but preferably in the morning, right after breakfast. Make sure you have a good protein, high protein breakfast or high protein meal if you're doing it mid-morning, and making sure you're on top of your electrolytes and your water before this medication. It's basically going to help pad the tummy, pad that gut to where it doesn't hit your tummy as hard and you don't have the side effects of the nausea and the diarrhea and the reflux that happens because things are slowing down. So that's the first thing from a nutrition perspective, is make sure that you are eating a solid meal, hydrate with electrolytes in preparation for this medication.
I love that. So just to echo what you're saying, here when our clients start at Lalore Health and Wellness, we encourage them to have a high protein, drink lots of water, like she mentioned, those electrolytes, because we don't want the weight loss happening from muscle loss, right? So we need to make sure that we feed those things, which is increasing our protein. Also, protein has a nice steady flow of blood sugar release throughout the day. And so we're not going to crash. And if we crash, then we're going to crave, because your body's going to want to be like, I don't have enough sugar. And when we crave, we'll crave a carb or a sugar to get that spike in that sugar. But it's not good for overall health and wellness maintenance. Okay.
I'm so happy you mentioned that about the craving for the sugar.
Yes.
Because typically when you do have cravings, if it's stress-induced or just because you've gone too long without eating or however, it is typically sugary, greasy, salty. And those three types of food is what actually makes you nauseated and have the worst outcomes when it comes to GLP-1.
That's so true.
So we definitely want to make sure we're not eating sugary foods when it comes to GLP-1s, because again, things are slowing down and it just sits on your tummy a long period of time, especially the greasy food. It just sits there and more acid production is produced there. So, but one of the things about GLP-1 is if you do try to eat those things, you're going to have such a negative response. It is not going to be attractive to eat those things. But I have seen clients who try to maintain the same type of lifestyle as before and the same type of eating pattern as before, and they'll immediately say, this medication is making them miserable. So the tool of the medication is to help you rewire your cravings and your habits. Because it does give you such a negative response when you try to maintain that same eating pattern.
Yes, I love that, because there are food aversions that can happen. And those food aversions, I've had patients say that sometimes they'll taste salty to them, that things that they used to enjoy. One of the things that we're seeing, now this is anecdotally, there has not been studies shown yet in regards to GLPs and using it for addiction medicine. But what we're seeing is that there is such a strong covering of that dopamine response that happens when we eat sugary things or things that we find that gives us that rush of dopamine. And when you don't get that response in your brain, then you're no longer wanting to enjoy those things from a stressful response. So I love what we're talking about, because I think that people need to understand this medication. I always tell people, I geek out when people start it, because metabolically, you're becoming the healthiest version of yourself with assistance. Now, while that food noise is quieted, you really need to do the work with changing your nutrition, implementing better eating habits, workout habits, and a lifestyle in general, while that food noise is quieted, to sustain a habit, right? And so on the outside, the side effect is actually weight loss. Right. So it was never the original goal of the medication when it came out. It was for diabetes.
Yes, it was. Yeah. This medication's been out for a long time. It just hasn't had that the notoriety that it has now, because it's kind of like, well, it's like, it's like, oops, like, oh, it helps with all these things. But in terms of what they're seeing in terms of the studies is that GLP-1 receptors is not just in our gut, but also our kidney, is also receptors on our heart, as well as the brain. It's everywhere. And so whenever we are using GLP-1 for cardiometabolic conditions such as type 2 diabetes, high cholesterol, high blood pressure, it's because it does help our heart beat more efficiently. It also helps give us some kidney protection as well. So those who are in kidney failure, kidney disease, are seeing that it's slowing the progression of the kidney disease there, and also to help with the blood pressure regulation. So it does more than just the weight loss. But again, this medication is a smart medication because it does hit all those receptors. But the only way it can really be smart is by you adjusting to those outcomes. Like you're not craving things as much, or you not wanting to stress eat, or however. So you have to get online with it. Otherwise, it's not going to work. But it is a smart medication, but it's not a magic bullet. Because you have to do the work.
There's still work.
There's still work to do.
Lots of it.
There's still work to do. 100%. Because I have seen individuals try every different type of GLP-1. And they're saying, oh, this class of medications doesn't work. I'm like, no, it's because you didn't work with it.
Yes. And I want to also poke the bear in the room a little bit as well. You know, a lot of people are coming out and saying that GLPs are the lazy way to get things done. And I think that's very offensive, because it is a tool to use to help you. Like, I was just talking to one of my patients this morning, and I said, as we get older, our vision decreases. Does that mean that we don't need glasses?
Yes.
So as we get older, there are certain things that happen metabolically that can get slowed down, that can increase your risk of insulin resistance. Stress can increase that risk. And then we can have increased cortisol. You know, story time for me, I just went to the doctor and my A1C is 5.9.
Really?
Yes. My A1C is 5.9. So for those of you that don't realize the magnitude of that number, 6.5 would put me in diabetes. And why I'm telling you this story is because stress is a destroyer of your immune system and your body. You see, I am not overweight. However, I do have prediabetes. And because of that prediabetes, it was the chronic stress, which induced insulin, and my cortisol were high, and I just was functioning through it. And I didn't realize it. So the vital importance of making sure you know your numbers, because you may feel like you're okay, and on the outside, you may not feel like this is an issue for you, but it could be an issue. And when those numbers are in the pre-diabetic realm, some studies are showing that the beta cells within the pancreas that are helping with insulin and making healthy insulin are affected in pre-diabetes. So it's not a place that you want to be. So know your numbers.
100%. Definitely. And it's one of those things too, just don't take your provider's message of, oh, you're not diabetic.
Oh yeah, so we wait.
Wait for what? I always ask, like, what are we waiting for the disease to happen? So definitely stay on track of how your numbers are trending. If you are, let's say, at 5.5 in 2021, and then 2023, now you're at 5.7. You're like, okay, now I'm trending. So that way you can slow things down. To your point, type 2 diabetes happens when those 50% of those beta cells are dead.
Yep.
They can't compensate for the excess glucose. And also, too, going back to the GLP-1 medication, if you do have a family history and or you're after 40 and things are getting a little bit harder, to lose the weight, you're working out, you're eating well, that sort of thing, just don't say, oh, this is a part of the aging process.
Yes.
It is not. It's not. So this is yet another tool. You say, you know what? I have family history.
Yes.
I'm doing everything I need to. I know my hormones are changing because I'm going through menopause or however. And advocate for yourself so that way they're just not giving you the line of let's just sit and wait, or here, just take metformin or whatever. So that way you have more tools in your toolbox, because shockingly enough, I've ran into some providers who just are not aware of how GLP-1 works. And I'm like, oh my God, it's one of the greatest tools out there.
Yes.
But it's definitely not a lazy way out, because it's not one of those things you just inject and just go about your life.
Yeah.
You do have to make adjustments in your life.
Yeah.
But the beauty about the medication is that it allows you to see the rewards of your work. Because that's one of the most frustrating things, is that if you're in the gym, you're eating healthy, you still can't get the numbers down, whether it's a scale or your blood sugars or however, and you think something's wrong with you, when in fact, maybe your metabolism is a little bit sluggish, or maybe those remaining cells in your pancreas are just a little worn out. And the GLP-1 does help proliferate more of those cells there. So definitely don't look at it as a lazy way out. I know that in the media, it has been given the image that you just take it and everyone loses weight, and that's it. But that is not
true.
the case. That is not the case. And those who do take it for that reason as an easy way out, those are the ones that gain all the weight back because they weren't doing the work. So it is simply a partner. It's a partnership they have to take on.
It is. And so, I would like to get into also the timing of, because you mentioned it a little bit earlier, when to take the semaglutide or tirzepatide, and why the timing of taking it is.
Yeah, absolutely. So timing of this medication is important. So it's at its max potency from a time that you inject to about 3 to 4 days afterwards, because it's every week. It's a once a week injection. So around day 5, day 6, day 7, you may notice I'm feeling maybe a little bit more cravings, or I can eat a little bit more of that, what's going on there. So I always tell my clients to count it backwards. So look at your week. So let's say the weekend is when you lose your mind, or things are just, erratic. You're not in schedule, or maybe you have more social events that you're going to on the weekend, and you want to make sure that food noise is calmed down, or you have a little bit more awareness of when you're full, right? Because I know in social settings, we're just talking it up and just grabbing things, and we've overeat. So I tell my clients, if Saturday is your day where you loosen up or lose your mind when it comes to food, take it on Wednesday, because Wednesday, Thursday, Friday, Saturday, you're still in the peak of that medication. So look at it your week when it comes to that. You're going to get the maximum effect of calming the food noise and being more in tune of your hunger and satiety cues when it comes to that. And also, too, if it's one of those things where you may have to change your dates. And some people say, I do it on Wednesday, but now I have to do it on Sunday. It's totally fine. It's fine. It's totally fine when you do that. So always count it back 3 to 4 days to see what's going to be happening in that time there to get the maximum effect of it. And then in terms of side effects, when it comes to the nausea, the headache, the fatigue, things like that, we typically see those side effects within the first 8 hours or 24 hours. That first day could be a little brutal when it comes to the headaches and things like that. So that's why I say don't try to sleep through it, because you're going to wake up feeling awful. So do it during the day, so that way you can get restful sleep, but also too, you can make the adjustments along the day. So making sure you do your electrolytes and all that throughout the day, because electrolytes does help with the nausea. It does help with that. It helps with the headache as well. Also, to the fatigue, it definitely helps with that. So doing it in the beginning of the day, the middle of the day is definitely a key there to help with that. So, so biggest thing is count it backwards, 3 to 4 days, see what's going on. take it mid-morning or morning so that way you have enough time to adjust throughout the day and get enough electrolytes in, because taking it at night when your tummy is going to be emptying is just going to hit your GI system a little bit harder.
Yeah, I love that. I love that. And so also, I want to also say, date your providers. And what I mean by that is, like, it's okay if you meet someone, a provider, and if you guys are not vibing, then you're not going to be able to be transparent in discussions and conversations that you're having with your provider. And then that makes the relationship to get you happy, healthy, and whole not going to be beneficial for you. So at the end of the day, you are the CEO of your body, right? And I want you to be empowered to make those decisions, right? Us as medical professionals, we went to school. Yes, we have studied these types of things, and we will provide you the information that we think will be beneficial based on the educational experiences and then the experiences that we've seen our clients have. But at the end of the day, you are the CEO of your body, and you need to take the information that we give you and then delegate to whoever you need to do in your body to make sure that you are becoming a happy, healthier, whole person. So the reason why we decided to do these series, you'll see more people come on like Russ, is because I want you guys to be taken care of holistically, right? I can preach till I'm blue in the face about your nutrition status and what you should do. But at the end of the day, I am a family nurse practitioner. And although I do have some education in nutrition, I am not a specialist. She specializes in nutrition and what it does for your body and the dietary recommendations and all the things food related. And so having her in this partnership, is very important because our body is just not categorized in certain things.
Yes.
We all work together for the good, who serve God. I have to throw God in there. So I think that making sure that you have the most up-to-date education. Do not go to theonion.com. I don't know if that's a thing anymore. But make sure that your peer-reviewed articles, if you have questions, talk to your provider if you have questions. And if they get offended by you asking questions, that may not be the person for you.
Oh my God. Yes, 100%. I love the date your provider. I'm gonna take that. I'm gonna take that. But no, it is. You are definitely the CEO when it comes to your body, because your provider only sees you maybe 15 minutes and you're living.
We're different.
Yes, no, definitely. My clients are hot maintenance. They're always texting me all the time. But traditional providers may see you for 15 minutes, but you're in this body 24/7 every day. And so you know of how you feel. And also too, you also have your own health philosophy.
Yeah.
Some people feel like, when it comes to the GLP-1s, they're like, I just want to use this to get the next 30 pounds off, and we want to make sure we're on the same page and make sure that we're not talking about, because some people have to be on a long term, and that's okay. That's okay. But if you feel like this is something you don't want to do long term, then we make sure we're on the same page and setting the right expectations, because that's the worst thing, is to say, okay, yeah, I'm gonna get you the 30 pounds off. And then we're not thinking about what happens after the 30 pounds. And then we're just left like, okay, now I gotta take this forever. And then that wasn't the goal. And definitely ask questions. We're practicing, meaning that we're practicing with the latest information that we have in front of us. But you guys impact the information that we have by telling us how you feel and, being truthful with the response and, all of that, so that way we can be better practitioners. It is a collaborative effort. And your provider should never get upset at you or thinking you're challenging their training or anything of that nature, because we're learning from you. That's what makes us great provider, is you're learning from each other. And also too, your provider, like you were saying, like you practice in medicine, you've done your training and all of that, but it's a team approach. If they're not referring you to a registered dietitian or maybe to a personal trainer or even a cardiologist, it's a team approach and everyone should be on the same page. So but if your provider is saying this is it, there's no other answer, question that. especially if you feel like you're not getting the answers that you feel like you should be getting. So
Yeah. And you're allowed to do that respectfully, of course.
Yeah.
We're not saying, Russ and Tammy said, no. There's a way to say it, So I think that these conversations are important because for so often, I personally don't wear a white coat when I'm practicing because I don't want it to be seen as a hierarchy or a hindrance for you to be your authentic self and for us to get into the weeds of why you're feeling the way that you do.
100%. Yes, that white coat is hanging up in my closet.
Yeah, because there's a whole diagnosis, white coat syndrome, that can elevate people's cortisol and stress response. Pupils dilate, heart rate increases, blood pressure's through the roof. There is real data to say that is a thing that happens. So why would I want to trigger you as soon as I walk in the door? I don't want to trigger you.
Absolutely. And we're all human, right?
Yes.
So just like we're the experts in our training, again, you're bringing your expertise of what's the experience like living in your body.
Yes.
Right. And so that's what we're here for. So no, definitely, again, ask questions. If you feel like you don't understand something, don't feel like it's a stupid question to ask. This is your body. If there's something that you see on onion.com, bring it to your providers. Bring it to your provider so that when we can either confirm or deny, what you're reading, because we are definitely not at a deficit of information.
Yeah.
We are not. But a lot of things can get misinterpreted or halfway reported or outdated. So definitely, check with your provider when you're reading something, because you too are tailoring your experience when it comes to your healthcare plan.
Yeah. And, some people we do more supplements now, as you grow in practice, you grow in experience, and, we have to do CEUs, which are continuing education, to make sure we stay on the evidence-based practice and the most accurate information that we have at this time. So it doesn't mean to say 3 years ago when I saw Tammy didn't say this.
Yes.
Right. Well, Tammy back then had information back then, or Russ back then had information back then. So, as we're humble enough to say we are growing right along with you. And if you have information, data, or whatever, I love learning. So bring it to our attention, and so that we can formulate a plan that gets you happy, healthy, and whole. So one of the questions that I often get to is the difference between tirzepatide and semaglutide. I'll just briefly talk about semaglutide uses half of the incretin system of the gut, whereas tirzepatide uses the whole thing. Tirzepatide tends to have about 20 to 22% of total weight loss overall for the first year of use, whereas semaglutide can be around 12 to 15%. So some people tend to have more side effects on semaglutide. Some people have more side effects on tirzepatide. We won't know how your body will interact until we actually do it.
Yeah.
But a lot of the common side effects we discuss: constipation, nausea, acid reflux, headaches. I did want to touch on sometimes when you have low energy, when you're on these medications, it's because you haven't been eating. Yes, it will quiet the noise, but you still have to eat.
Yes, 100%, 100%. And if anyone is telling you otherwise, question them. But yes, you definitely have to eat, but it's different because since the semaglutide or, even the GLP-1s is quiet the food noise, you don't really get that strong hunger, pain, sensation as before. So you really have to schedule and plan out what you're going to eat for today. Because, on a normal basis, we normally really reactive to our hunger. Oh, I'm hungry, bam, I need to eat, right? Versus when you're on a GLP-1, you're not going to have that sensation. So you have to get yourself on a schedule of okay, I eat within an hour of waking. By 4 or 5 hours later, I need to check myself to eat again, even if you don't feel like it, because that sensation may not be there. So to say I'm going to eat when I feel hungry, you may never feel hungry on GLP-1. And you may start, those protective mechanisms of feeling shaky, a little dizzy headed, that sort of thing. That means you have gone past the point of hunger. So you definitely have to get yourself on a schedule when it comes to the GLP-1s, because you're not going to have that same sensation, to make sure that, one, you're preserving your lean body mass, throughout the day because protein is essential. Now, mind you, with my clients, I understand that with this slowing of this gastric emptying, trying to eat a full meal may not be doable. It may be so miserable to try to eat a full meal. So definitely put in your arsenal things that are not going to produce a lot of gas. In terms of like the cruciferous vegetables, like your broccoli, your cauliflower, some of the onions and the Brussels sprouts, things of that nature. You may not be able to tolerate those things, but things that are like your squash, your green beans, your carrots, just soft vegetables, that may be your deal there. Using protein bars, protein shakes, those are definitely good strategy. Or the jerky sticks or cheese to get in that protein. And so don't force yourself to try to eat a full meal. You may eat small portions. You may have to split your meals out there. Again, with the food noise and some of the head things that change when it comes to meals is shrink your plate. If you're eating off of a large plate, it can feel so overwhelming and just your eyeballs feel like, I just can't do it. I'm going to feel so nauseated.
Yeah.
Shrink the plate so that way mentally you can feel like you can complete the meal, but also too, you can be in more check with your portions there. So definitely shrink the plate. But something that I tell my clients is that you want to get about 70% of your protein fat between the hour of waking up and around noon to 1 o'clock. That's the key.
That's good.
So that because as the day continues, you're going to feel less and less hungry, and things are slowing down, and you don't want to force yourself to eat a large dinner, and then you go to bed and you feel awful on this semaglutide because things are, one, slowing down because of semaglutide, but also two, you're not moving as much and you're resting. So what that will look like is if you want to do
Someone's at the front door down.
if you want to do a protein shake with a piece of fruit, make sure your protein shake has around like 25 to like 30 grams of protein, if you can do that. And then, so using a protein supplement of your choice. Most of my clients do really well with the plant-based protein powders and protein shakes because it's a little bit easier on the tummy. Versus the milk-based ones, but it's your preference. But at least get like 25 or 30 gram minimum when it comes to those protein shakes there. And that's something you can sip on, for a couple hours or so to get that in if your tummy is a little bit weak. But skipping is not an option. Even if you do a bar, if you want to start out with half the bar just to prime that gut. And then once the gut gets a little agitated and some movement there, you can tolerate the other half of the protein bar. Pairing that protein with fiber.
Yes.
Fiber. I could not hit on how fiber is so important with this GLP-1 medication because it is slowing down how things move. And we're focusing on protein, and protein can be constipated as well. So making sure you're getting in fiber. And so I understand that some of the veggies may cause a little bit of disruption, but it's okay to have a fiber supplement where you're doing Miralax and you're doing Metamucil. So something that my clients do, they'll do Miralax, like one, serving of the Miralax every other day. And the days that they're not doing Miralax, they're doing the sugar-free Metamucil. Sugar-free, because Metamucil does have some sugar added, which is so odd to me.
And the gummies. And all gummies, whatever vitamin you're taking, check the sugar.
Oh my God.
So much sugar.
Yes, absolutely. It's so funny that, and just a little sidebar. I had one client like, I'm not sure why every morning I can take my supplement, my blood sugar spikes. I'm like, because it has sugar on it. So definitely check your supplements. But there's tons of cool products out there, not sponsored, but it's called Shameless Snacks. Shameless Snacks, there's a 1 ounce pouch. It has 23 grams of fiber in it. Yes, and it tastes like a Sour Patch Kid.
Oh.
And there's another one called Oomph. It's OOMPH. Yes. Again, not sponsored. That one, too, it has around 23 to 30 grams of fiber in it. And so if you do have a sweet tooth, or if you do have like that, craving for that sweet, salty, the Oomph one tastes like Starburst. Yes. But also too, it helps with, keeping you full, because fiber does keep us full but also helps with bowel regulation. And to be honest, I would not recommend eating the whole packet in one sitting, because it is 1 day's worth of fiber in one thing. You will have some problems, but it does help with that. So the fiber is definitely an important part of making sure you're alleviating the constipation that you're having with this GLP-1 there. So again, when it comes to the eating, we definitely don't want to skip. We definitely want to maximize on protein with the utilization of protein bars and the shakes, because of just helping with things ease through your tummy. Even if you do animal-based protein or like a whole protein, make sure that it is chopped up in small chunks. Make sure you chew thoroughly, so you will have to slow down your eating. Be mindful. It takes about 20 minutes for our gut to realize that we're full, but with GLP-1, things are a little bit sooner than that. So make sure that you do slow down, small bites, so you can get that in there. And then when it comes to bridging the nutrient gaps, I get it. It's going to be hard to get it in. A multivitamin, because there are going to be days you just do not want to eat, and you may create some nutritional gaps, the deficiency. So I hear about ladies complain about my hair is thinning, or my nails are breaking off, or my skin is looking a little bit dull, because you have created some nutrient deficiency. So definitely get yourself a multivitamin there to make sure you're filling in some of those nutrient gaps as well. So what your day would typically look like, you may be able to get in 2 meals, like maybe breakfast and lunch, and maybe like 2 to 3 small snacks. That's typically what it looks like. So, and don't feel bad about that at all. So I know that some people, depend on what their background is, they feel like they have to clean the plate. Oh, you don't have to clean the plate. Oh, no, wash the plate. But you don't have to clean the plate. It's okay. And that's the benefit of GLP-1. It really helps you connect when you've had enough, and you can push away, and it's okay to do that. So
Russ she's preaching right now. So some of the other guests that you'll see is our very own trauma therapist. And her name is Baylin, and we talk about the traumas of childhood that can affect the food choices that you make and the way that you even eat. Like cleaning your plate is based for a lot of us in trauma, because, back then it was the kids in Africa were starving, and how dare you not eat everything on your plate, even though you told yourself that you were full. So you learn to suppress that button at a very young age. And it can be very triggering when you get older, because it's the same methodology, but you're no longer feeling hungry, but you'll force yourself to eat. So I love what you said. Another thing that I want to just drop it in the bucket is be careful of juicing.
yes,
Juicing removes all the beautiful fiber of that plant or that fruit that is required to slow down the sugar spike.
Yes.
Okay. So when you do that, you're going to spike that sugar up, because who can eat a whole bag of apples and a whole bag of carrots? You physically cannot do that. But when you're juicing, you'll be surprised. You can juice a whole bag of apples, and it's probably this much juice, because all that pulp and that fiber was removed. Yes. But what you're doing is a huge injection of sugar that you really shouldn't be getting. So introduce that fiber. It is the antidote of spiking that blood sugar to help you not only regulate your bowel movements, but then also regulate the spikes in your sugar that can lead you to an increased risk of diabetes.
100%. And also, too, to piggyback off that, the importance of fiber is those who are suffering from insulin resistance tend to have compromised gut health. Yeah. And that fiber actually adds good gut bugs back to our gut, so that way we're not so, I call it, picky when it comes to eating carbohydrates, because I've heard people with clients are like, even if I eat beans, even if I eat peppers, my blood sugars just go all over the place. I shouldn't eat those things. I'm like, no. That's a sign of compromised gut health, and you don't have an adequate amount of fiber in your diet to build up those good gut bugs. They help you metabolize carbohydrates. So definitely get on top of the fiber game. Also, too, when it comes to menopause, menopausal women who have a high fiber diet and a good gut health, they tend to have less amount of symptoms with the hot flashes and all the other sleep disturbances and all that. They have a better experience going through menopause by having good gut health. So yes, fiber is the MVP.
Yes.
When it comes to our health. Also too, just for certain types of gut related cancers.
Yes.
Fiber actually dilutes certain types of carcinogens in our gut. So we don't absorb those things. And when it comes to like colorectal cancer and different things there. And also to those who are dealing with, PCOS and like that, it helps with stabilizing our hormones. So yes, so definitely don't skip on fiber by any means when it comes to that. So yeah.
Oh my gosh. So if you all enjoyed this, let us know in the comments, like, what topic should we discuss next? Should we do this again? I think yes. I'll probably override the vote. I say yes. We need to do this again and get down to the gritty, like menopause and other things that we can see and how we can do that through nutrition.
Yes. Yes.
And so Russ, tell them how they can get in contact.
Yes. So several ways you can get in contact with me. So if you're on social, on Instagram, if you put in fat loss, diabetes, dietitian, you're going to see my face show up. Russ Powell is what you're going to see on there. So you can follow me there. And I'm very active in the DM. So if you want to DM me a question because you've seen this podcast episode, you're like, hey, Russ, what about this product? What about that? I'm definitely highly responsive there. But if you need something a little bit more closer and more intimate to where you're like, Russ, I need a plan. I need to figure this out. Then you can email me at contact@RussPowellNutrition.com, and I will definitely have my phone with me at all times. I definitely hit you back up so that we get to the consultation. Consultations for me are free, just for us to have a conversation on what your expectations are and what your challenges are to figure out if I'm a good fit for you. And we can get you on. If not, I'll obviously refer out to who is. But yeah, that's how you can get in contact with me. Insta or email me.
Yes. So I hope you all enjoyed this as much as I did. This was truly fun. And it was a wealth of knowledge. If you're ready to get your GLP-1 or semaglutide, tirzepatide journey started, let us know here at Lalore Health and Wellness. We would love to take care of you. We can also, we will work together with her to get a plan that works. It is not just about, semaglutide or tirzepatide, but we also do take insurance and getting your metabolic needs and making sure that everything looks good. And to piggyback what she said about vitamins, we offer vitamins shots. So that's something that, and vitamin IV hydration. So sometimes we just need to bypass the gut altogether and let it get some rest so that you can get those vitamins infused directly into your bloodstream. So let us know how we can help. You can always text us at 214-393-5538. Let us know that you saw this episode, comment Russ, and let's see if you get a special promotional package, okay? It's been lovely, Lalores. We will talk to you soon. Have a wonderful rest of your day. Bye.